Good morning, everyone. I'm Cindy Kenis. I'm clinical nurse specialist in geriatric oncology, working in the University Hospitals of Leuven here in Belgium. And this year, I'm the co-chair of the scientific committee that is leading to the program of this year annual conference of the International Society of Geriatric Oncology. So I'm happy to share today some my reflections on the role of nurses within the field of geriatric oncology. So I think my main message today is the fact that nurses are becoming key leaders in geriatric oncology. Nurses, as the population ages, we see more and more older patients with multiple comorbidities, polypharmacy. They might be frail and vulnerable. And that's where nurses have stepped forward because they notice changes. It can change quickly, and they need continuous monitoring and assessment. And that's where nurses step forward. Nowadays, we see that more and more nurses taking up advanced or specialized roles. So we see advanced practice nurses, clinical nurse specialists in the field of geriatric oncology. They are leading the geriatric assessment and management. They are helping to guide treatment decisions, and they use geriatric screening, geriatric assessment, and other things more consistently in their daily work in practice. And since nurses are following the patient from diagnosis through treatment, through survivorship care and end-of-life care, they can notice small changes can be big difference for the patient of all the patients with cancer. I think it's very important to mention that at this year's conference of the International Society of Geriatric Oncology, that we see many impressive nurse-led innovations. They are leading nurse-led geriatric oncology care models who are completely focusing on the care for all the patients with cancers and all the aspects that are relevant in the care for all the patients with cancer. The results of those geriatric oncology models are very clear, I think. They make sure that possible problems are detected more earlier, that there are more proactive geriatric interventions undertaken, patient goals and preferences are integrated in the treatment decisions that are made, and there is more support for caregivers. And that's exactly where the role of nurses is highlighting itself. And that's why it is so important in the field of geriatric oncology. I think in the future, we need to emphasize that we keep supporting nurses by education, by training in the field of geriatric oncology, that we need to support our nurses in more advanced practice roles, and that we need to make sure that nurses are involved in research and in clinical trials. And that's where collaboration with international societies like Geriatric Oncology, the International Society of Geriatric Oncology, but also the Nursing and Allied Health and Scientist Interest Group can be very helpful. And I think my main message will be the fact that in comparison to the past, I think that nurses are not longer just part of the multidisciplinary team, but they are becoming key leaders within the multidisciplinary team taking care of the older patient with cancer. Thank you.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.